Hello and welcome to Senior Speak New Hampshire on your Concord TV, sponsored by AARP. I am Karen Ulmer-Dorsch, the producer host of this program, and I welcome you today as Kathleen Clark and I delve into a service that I think may be of interest to many of my viewers, and that is concierge nursing. A service that's available for those who can afford to personalize their health care to meet their specific needs. Kathleen is a concierge nurse living in Samberton, and after learning about concierge nursing and medicine, from her, I suspected that there were a number of my viewers who might be interested in this available resource. So I invited her to be my guest today. So Kathleen, thank you for being here, and let's jump right in.
Absolutely.
Please give us a little brief explanation of you, and then exactly what is concierge medicine, when did it begin, and why?
Sure. Well, I'm Kathleen. Thank you for having me. I have lived in New Hampshire my whole life and heard about concierge medicine and this new sort of field in the medical world, and was just very intrigued by it and decided to start my own business with it. So concierge medicine is really medical care in which a physician or a nurse is employed directly by a patient. So it kind of cuts out the middleman of hospitals or other clinics and makes it so that the healthcare provider is working directly for a patient. It's typically a private pay service, although as it's growing in different areas, there are some organizations that are sort of a scaled pay service. So, some people pay a concierge rate and some people pay a significantly discounted rate. But the whole point is to really get back to what the patient needs.
Okay, kind of like when I was a little child and the doctor came to my house.
Yes.
Rather than me having to go to the doctor's office.
Exactly.
That was many,
Yes.
many years ago.
Yes.
And so you did mention this was a fairly new practice. Do you know why it started, or what was the purpose behind this, other than getting back to a personal? Did it have anything to do with COVID, or was it before COVID, or what?
Yeah, absolutely. So this, I think, is, like you said, it's not entirely a new idea. I think that, back even 50 or less years ago, there was primary nursing in which you had people doing similar things. But over the years, that kind of went to the wayside as sort of health infrastructure grew. And that wasn't necessarily allowed or doable for many reasons. But then sort of in probably 10 years ago or so, there began to be information available about what was called VIP medicine. So this was for people who, were well-known, influential politicians or things like that. And so the secret kind of got out about VIP medicine, and people who were affluent and could afford to pay for these types of services said, I want a piece of that. I want my own, individualized medical care. So that was sort of where concierge medicine was born. But now, it's grown a little bit, and it really became popular in areas like California and New York City, where a lot of plastic surgeries and elective procedures are done. So that's where it was sort of birthed. It became popular because, people are paying for these services out of pocket anyways.
Right.
And so paying for direct access to a physician or for their own individual nurse is well worth it, since they're paying so much for these procedures anyways. So then, as that was gaining more popularity, we did see the word kind of get out about these sorts of organizations. And so I think that people from there saw that and said, well, wow, this doesn't have to just be for people who can afford to pay huge bucks for these sorts of services. Everyone deserves, this special individualized care. So that's why I think those sorts of models have grown, where somebody offers, both a sort of higher concierge rate to kind of balance out the lower income rates or free services for people. So that's been wonderful. And I do think that the pandemic had a lot to do with it. We saw this gaining in popularity before the pandemic, but then a lot of the issues in the healthcare system that were starting long before the pandemic, nursing shortage, physician shortage, all of those things, issues with insurance reimbursement, those sorts of things have really put pressure on the medical system as a whole, and pressure on physicians and nurses because, in a primary care office, for example, a visit that, even 10 years ago, they would have 30 minutes carved out for that type of visit. Nowadays, they have 10 minutes, and it's just not enough time, to actually speak with a patient, educate a patient, and give them the care that they really need to help themselves. So the pandemic, I think, sort of catalyzed those issues that were already happening, because we did see a lot of people leave the medical profession because of the pressures that were existing at that time.
Nurses as well as doctors.
Yes, yeah, absolutely. So I think now we're seeing a big upswing in the attention that's being paid to this, because I think people really just, we all got into this to help people. And so I think that it is wonderful that you can have that special relationship with the patient and view them as a whole person and take the time that you need to.
So benefits, you've mentioned some. Are there disadvantages?
I would say that probably the only disadvantage would be cost, because a lot of these are, pay for service, or, I think that concierge medicine, when it's done by physicians, you typically pay sort of a monthly or yearly rate for the services, and with concierge nursing, it's more hourly rates. So certainly there are barriers with cost.
So talk a little bit about, is there insurance involved here, or how does that work if people have insurance? How does that work?
Yeah, so every organization is different, because again, it's so individualized. So, but typically concierge care is not working with insurance companies. There are some who work with long-term care insurance, and there are some who work with sort of the health savings account dollars and things like that. But typically it's sort of, not working with insurance, because that's where, some of those restrictions on time that we see in the health system, that's where it comes from. So,
Okay. All right. So let me see where. All right. So prior to becoming concierge nurse, what was your profession?
Well, I've been a nurse for some time now. My background is ICU nursing, and I worked at Dartmouth Hitchcock at a complex medical floor, and then did ICU nursing. And even before becoming a nurse, I actually worked as an EMT for a long time in New Hampshire. And it's actually been wonderful, because all of the jobs that I've had have really given me a large perspective on the medical system as a whole, from the ground up. And actually just prior to the pandemic, I left the ICU that I was working at and became an infusion nurse. And that's why I kind of got to thinking about this, because I was, in a clinic doing infusions, and my patients would come to me with, all of their paperwork for all of their visits from the last 6 months of, their hospital stays and clinic visits, and they'd be like, please help me sort this out, please, because you're the only one that I can ask and is going to give me some good answers. And that's, the sort of the feedback I heard over and over was, people just need more help, and they need more information, and they need the time taken to give them education so that they can make sense of what's going on.
Do you find that because our population is aging, that becomes an even more need? Because I'm one of those, and insurance means, it just goes over my head.
Yes, I think definitely. I think that, the population is aging at the same time as what I mentioned before with the physician shortage and the nursing shortage. So there's not enough resources available right now in the health system as it is currently in existence to help everybody how they need help. So this really serves to insert itself in those sort of niche areas, so that people can get the help that they need.
And why would a physician, for example, I told you that my primary doctor I found out was a concierge doctor. I didn't have any idea he was. Why does a doctor who is practicing in a clinic or a hospital switch? What's the advantage for him or her?
Sure. Well, I think that we all, as healthcare providers, we all got into this to help people. We all got into care for people. And when you go to work every day, leaving, feeling like I just didn't have enough time to actually help, that's hurtful. And especially over the long run, that's not why any of us got into this. So there's a huge advantage as far as, your moral and emotional health as a healthcare provider in doing this, because you can actually give people the attention that they need and the help that they need. Additionally, you can kind of focus on the things that you're most passionate about. So as far as the concierge nursing goes, for example, if you were a surgical nurse for 10 years, then you can say, okay, post-op recovery is what I love to do, and that's what I know the most about. So maybe a surgical nurse can go and do post-op recovery. There's a lot of areas where I think that we'll see this sort of growing. I think that behavioral health is huge. I think that behavioral health nurses, there's such a need for this in that area. Functional medicine, which looks more at diet and exercise and big lifestyle, the sort of big picture stuff. That will be huge, I think. And for me, my sort of special avenue was faith. So,
So, did you, in transitioning, was there further prep that you had to do, or did you have to pass exams, or how did that work?
So no exams, but there was a significant amount of prep work. So we're licensed by the State of New Hampshire Department of Health and Human Services. And that, there's just an extensive amount that goes into doing that. And that's a health rule under the health facilities area of the Department of Health and Human Services. So that rule, sort of dictates the requirements for me as the owner of the company, and the various positions that need to be filled under that health rule.
Okay, so you operate independently from all the other concierge medicine businesses and so on. Because I noticed in doing research after I met you, I went on the web to find out what I didn't know. And that was pretty astonishing too, because there are different names for all of this stuff and different programs and so on. And so how does an independent nurse connect with that, or do you, or don't you, or what?
I don't think it's necessary. I think that there are a lot of because this is growing so much. There's a lot of concierge medicine companies, larger companies. Where you can go online, you can have a remote visit with a concierge physician. You can get anybody almost around the clock for a simple sick visit or something like that, instead of going into an urgent care or your primary care office. So that is available, but it's not necessary. You don't have to do that. I would recommend for anyone who's, I don't know if your viewers might think of doing this themselves, I would recommend getting licensed by the Department of Health and Human Services, and that is something that people might want to be a little bit cautious of. Yeah, because without that, there's really no backing for things like complaint procedures, and there's no one saying this is your patient's bill of rights, and these are the procedures that you can do if something goes wrong, which you don't like to plan on, but
so you want to be sure that the concierge nurse that you have contacted or doctor is legitimate.
Yes.
Because
yes.
there's a lot of fraud going around in
Absolutely.
everything
Yes.
now.
Yes.
Aha, well that's fascinating to
Yeah.
know. And there may be some nurses out there that are listening that would be interested in checking that out, I would think, you
Yes.
know. Yeah.
Yeah.
Okay, so let's say where we are. Okay, what would you like to tell me that I haven't asked you?
Well,
Talk a little bit about, do you make home visits, or
yes,
I mean,
yeah.
how does this go?
Sure, yeah. We do make home visits. We also have a remote option available. So, that advocacy piece is really important to me as a nurse. So say someone has a new diagnosis of, say, heart failure. So, that's going to require a lot of new education that they likely won't get in the hospital because of staffing challenges and time challenges. So they have a new diagnosis of heart failure, and then a ton of medications are changed. So we can go in and say, okay, let's look at all of your paperwork from that hospital stay, and then we'll go with you, whether it's in person or remotely, to your next office visit, so that we can hear what your physicians are saying, and then we can be available to answer questions as they come up and to clarify what was discussed, and to provide reminders or whatever someone thinks that they in particular need moving forward, so that they really know how to care for themselves and they understand all these changes that are going on in their lives. Additionally, one of the things that I think is so useful is family communication. So many people have aging parents across the country, and that's such a challenge in really feeling comfortable about knowing what's going on.
Right.
So, just offering family communication so that, people have a clinical perspective on what's going on with their parents, and their parents feel comfortable, where they're at.
Okay. Yeah, that would be interesting to recognize, because, for example, my husband and I, we're both in our 80s, and our daughter is in Kansas.
Yes. Yeah.
Well, you can imagine
Yeah.
what kind of a problem that would be were either one of
Yes.
us to become less healthy than we are. Does a concierge nurse work isolated, or is she in a hospital, or can she do both, or I mean, how does this work?
Well, really, wherever the patient needs, for me, it's wherever the patient needs me to go. Again, every company is different in the way they structure things, but for me, I go where the patient needs me. So that means I go into the home, that means I go into clinic visits and into the hospital with people, so that, they can receive concierge care wherever they need it.
Okay, and so for a physician or a nurse, does this cut down your load? In other words, what I mean is, would a doctor decide to become a concierge doctor because he's got way too many patients in the hospital or whatever, or can he do hospital and be a concierge doctor? I don't know how that works.
Some physicians are doing that. Yes.
They're doing both.
Yes, some physicians are. Sometimes they limit their, practice hours at the clinic or the hospital that they work at, and dedicate, so they become part-time essentially at their hospital or clinic jobs, and then dedicate, separate time
Do nurses do that also, or not?
I'm sure that they do, but because it's so individualized, it's difficult to know,
Right.
who's doing what.
Right. So, Kathleen, how accessible is this in our state? How accessible is concierge medicine or doctors or nurses in our state?
I would say it's just a phone call away, really. I think it's a phone call away for everybody, or a conversation away. More and more doctors and nurses are starting to do this. So if someone wanted to know if their physician or, that their physician would recommend someone, all they have to do is ask. The doctors are happy to provide that information. They're all aware that this is going on and that it's growing. So, people can certainly ask their doctors and or give us a call.
Okay, so give me an idea of your typical day.
Well, we typically do sort of our consultation meetings in the morning time, and then patient visits in the afternoon. But it really depends. It's so variable because our day depends on what the patient needs. So.
Okay. Okay. And what would be a typical workload or patient load? Is there such?
Well, it's up to the individual. It's however they want to structure it. So really, it's whatever.
When you say up to the individual nurse or
Sure.
doctor.
Yes. Yeah.
Okay.
Absolutely.
So this seems to me that would be very helpful to a young parent with children.
Yes, which I am. I am a young parent with children, and yes, it is very helpful because you're not trying to fill the schedule for a larger institution. You do get to sort of make your own schedule, so that's definitely a benefit.
So you can, as a concierge nurse, you can arrange how many patients you want, how many days you're going to do this, et cetera, et cetera, et cetera.
Absolutely. There's one caveat to that, and that is, again, that we all got into this to care for people. And so I think as healthcare workers, our tendency is to give a whole lot all the time. So yes, you can make your own schedule, but it's really hard to say no.
I can imagine that it is. Yeah. Yes. Okay. I'm trying to think if I have other questions or I have not asked you something that I think would be important for our viewers to have a look at.
Sure.
We're going to look at our notes for a little bit, people, because this is a complicated and new experience for both of us. Well, not for her, but for me.
Let's see.
Do because there isn't insurance that's involved here, this would be like me calling my TV repairman to come and do something and I pay him. Is that the way it works?
I mean, pretty much, but that's again why I recommend really looking for someone who's licensed by the Department of Health and Human Services, because there's a wide variety of TV repairmen, and some do a great job and some don't do a great job.
Right.
And if you aren't getting a concierge nurse who's licensed by the Department of Health and Human Services, then you're at risk for really getting someone who's maybe not willing to put in all of that extra work and who is therefore not going to do a great job.
Right.
So,
yeah. And as far as patients go, I would imagine, do you find that you have a category of patient? In other words, do you have a number of patients who don't want to go to a hospital, or they don't want to go to a doctor, or they don't want to go to a clinic?
Sure.
They want that to be the person to come to them?
Absolutely, yes. Yeah, home visits are an absolute benefit of concierge nursing, as well as being an adjunct to standard telehealth visits for their regular primary care physician or whoever they're having the telehealth visit with.
Mm-hmm.
We can help with that and actually do a physical assessment and provide that as an adjunct to the telehealth visit.
Uh-huh.
So,
And I would imagine also, do you have a number of patients who have disabilities? I mean, moving or, getting places.
Yes.
What about transportation, too?
Yes.
Because it seems to me one of the big problems that we have in San Bernardino, I know, is that we have a number of people who don't have transportation. They're not driving and they need transportation. They can't always find that.
Yes.
So that would be a very convenient
Yes.
thing for them to get involved in.
Absolutely, yes. We do offer transportation. We also offer things like prescription pickup services and, sort of errand assistance because, sometimes when you're sick or you've just had surgery or you're aging, you really aren't able to do that for yourself.
Right.
So those services all fall under our umbrella. But again, every service is a little bit different. So.
Right. And so let's say that you make a house call to an individual and you see that this person needs help beyond what you can give. then what happens? What goes on there? You know.
Well, it would be very rare for me to go to see someone who didn't already have physicians in place, so
Got it.
that communication with their existing physicians is very important, just like standard home health care.
Right.
That interaction and those relationships are very important. So, yeah.
Okay. Kathleen, I can't thank you enough
Thank
because
you.
I've even learned something now that I didn't know when we met earlier via Zoom, And viewers, I hope this has been very informative for you. And Kathleen, if people wanted to get in touch with you to find out more about this or to find out, how can they go about this, do you have a contact that you can give them?
Sure, absolutely. I think that they're going to put it up on the screen, but it is allyrn, ALLYRN.com or 603-560 or 530-1757.
Okay. And this is your private company. I
Yes,
mean, this is
yeah.
your, okay. Thank you again
Thank you so
very
much.
much. And viewers, I hope this has been of interest to you. It certainly has to me. And until we meet again, be good, do good, be one.